Mike and I have been married for 3 years, but we've been together for over 9. I knew I wanted to have, get married and have kids, and I could tell after being with Mike for a while, after we started dating, that that's what he wanted to.
It's just amazing now, looking back, when we were in high school. So I was a senior when we started dating.
I have been working at the medical center lab for 6 years now as a lab tech, and it's just a great place to work. I mean, it's kind of like we're just a family there. I was 2 months away from my due date. I had some cramping, some pain, but nothing I thought was a big deal. So I went to work the next day, and I'd say maybe the pain got a little bit worse. So I made the call to Jessica, Dr. Richard's nurse.
And so Jessica said, well, come up, and she comes up, and she sits in the office, and we just worked her in between patients. And she tells me her symptoms, and she's feeling a little pressure and a little crampy. So I wanted her to go to the birth center so I could do a special exam to kind of see what the situation is.
Dr. Richards checked me over and said, "You're 5 centimeters. This is happening today."
And then I caught a call from Melissa, and she's like, "Mike, I'm 5 centimeters. You need to get to the hospital now."
Panic set in, a whole range of emotions, I would say. I was excited. I thought, oh, she's coming early, and then realized how early it was and thought, this is not good.
When a baby is born more than 6 weeks early, it is a very serious situation. If you don't do things properly, it is potentially life-threatening.
When Mike got there, I heard him calling, his dad and his family, and he broke down. So then that's when I lost it. It was like, oh, this is happening. This is really scary now. After she was delivered, they, whisked her away right away. I got to see just a glimpse of her body for a split second, and I heard her cry, and that was, the best sound to hear. Dr. Richards said, "I'm canceling all my appointments. I'm gonna stay right here with you." And she goes, "I'm fine, just watching you." Time was a huge factor in this, and the nurses in the OB were wonderful. Dr. Richards and Dr. Myers were great. I mean, they saved our little girl. Oh, she's just so sweet. I couldn't ask for anything better. She's wonderful.
She's getting stronger, she's smiling more, and we just can't wait for her to say our names and crawling. And being a parent you can't explain it until you have a child, how wonderful it is.
All my life I've grown up around Richland Center, and I feel like it's a part of me, and I'm a part of Richland Center. Everyone is friendly, they're helpful, and I just think Richland Center is the only place to live. When I first started getting knee problems, it was several years ago. I had a hard time even doing my housework. I would work a little while and then I'd sit down. It bothered my back, and it really restricted my life. I couldn't dance. I like to dance. Dr. Beck said that it was bone on bone. The cartilage was gone in my knee, plus there was arthritis in there. And so there's no way that anything could help but surgery. But I was chicken. And I just kept putting it off, and finally I was just dragging my leg. I mean, I couldn't bend it. There was so much fluid, and so I finally decided to do it. When I had the physical therapy, I have to say it was really painful at first. It's a tough thing to do, but you have to just keep telling yourself, I'm going to do it because I want this leg to be okay. Kim, my physical therapist, was very friendly and very caring. Sometimes I just felt like crying, however I didn't. And Kim was very patient with me. I can do anything now. I can do things I couldn't do for 7 years, I think. So I feel like I can contribute more to the community, and I feel 10 years younger, or 20. Oh.
Cattle have been in our family. I mean, my grandpa milked probably till the early 80s, and I believe his dad was a dairy farmer too. Since the early 1900s, the cattle business has been part of the Kirshner family.
I grew up on a hobby farm. My dad and I raised shorthorn cattle. Then we started showing at the Wisconsin State Fair. And it was in about 1994 that I saw this boy across the show ring. That's why we today still have the cattle, and I don't mind them at all because I absolutely love them, and it's what we do. It's part of our life. All 5 of our children have been born at the Richland Hospital.
Our oldest daughter is Haley, she's 11. Mallory is 9. Ty's 7. Maggie's 4. And little Owen's just over 4 months.
Mallory, we actually noticed some abnormal stuff going on with a little bit of swelling, weight gain, just puffiness and all that. So we took her in. And that's when they ran some lab work and some urine and realized things were not in normal range and had some red flags, and she was diagnosed with the autoimmune disease called lupus. It goes to a main organ and just kind of starts attacking.
I don't think I'd ever, I may have heard of lupus, but it might have been in passing. So we were scared right away. We didn't know what the disease totally was, and it just kind of caught us off guard.
Our 7-year-old son, Ty, was then diagnosed as well with lupus, and I was like, really? Another one? Which the odds of that also are very slim.
It's hard because as a father, you want to be able to take care of everything for your kids, you know, and there's some things that are out of your hands, and it's just tough, you know. The medication that both Ty and Mallory are on, they suppress your immune system. They have to, because that's what's attacking itself, so they suppress that so they're susceptible to, I mean, a common little cold can be pretty serious.
Mallory's been on meds for 4.5 years now, and Ty, you know, since December. But it's what we have to do right now, and you don't want to say it, but getting used to it, you know. They are just normal kids as everybody else, and you treat them all the same and you go with it, you know. Going to the Richland Hospital sometimes for me, I'm embarrassed to come through the front door and be like, it's me again, but it's either a different child or maybe it's for me or whatever. But no one ever judges you. They never judge you, you know, which is super and great. It's always a hello, how are you, you know, and we are always treated with exceptional care.
I mean, I personally know a lot of the doctors, and there's just something about that when you know who they're going to see, that it's just, you just know it's going to be fine, you know. And we had one doctor come over and check Ty once, he said he'd stop by on a Sunday after church because we're just friends, you know.
I can't put myself in their shoes, and I want to. I want to so badly, not have them, you know, have that needle drawn or be so sick that they just have to spend a couple nights in the hospital. But I am right along with them, and so is the Richland Hospital. They take the time with each and every one of us.